Guys, welcome to today's training on bloodborne pathogen delivered by Osha Safety Consult Nigeria Limited, Osha authorized training provider. So today we are going to be talking on why should we learn or why do we learn about the risk of occupational exposure to bloodborne pathogens. Also be looking at the Osha standard. What does the Osha standard says about a bloodborne pathogen, as well as introducing you to some specific bloodborne pathogen as well. So let's start with why do we need to learn about the risk of occupational exposure to bloodborne pathogens. It said OSHA estimates 5.6 million workers are at risk of occupational exposure to bloodborne pathogens. All occupational exposure to blood or open place workers at risk for infection with bloodborne pathogens. Now, basically, any occupation or job that you have to do that has a tendency of exposing you to blood or other potentially infectious materials put you at risk of being exposed to these bloodborne pathogens. It could be as a nurse in working in a hospital, or as a head caregiver, or as a housekeeper, or as a nanny working in the school, or some working in a manufacturing company, or whatever kind of job that you find yourself doing that has a tendency of exposing you to bloods or other opium, put you at risk of being exposed to these bloodborne pathogens. As a result, employers are expected to train employees on this bloodborne pathogen and also have what they call the exposure control plan, ECP. The essence of this plan is to have measures in place to tackle any potential exposure to bloodborne pathogens. So what are bloodborne pathogens? Bloodborne pathogens are infectious materials in the blood that can cause disease when transmitted from an infected individual to another individual through blood and certain body fluids, understand? So the blood is basically talking about infectious materials found in the blood or other body fluid that can cause diseases and can be transmitted from one person to another. Has a tendency of causing serious illnesses and death in some cases as well. So example of common pathogens are you have the hepatitis B virus, which is HBV. You also have the hepatitis C, which is hepatitis C virus as well. So they are the common, as well as the acquired immune deficiency syndrome, talking about AIDS that can be resulted from HIV. Understand? So the HIV, HCV, and HBV are examples of some blood pathogens that can result to illness or even death, as the case may be. Then so we'll move on to the OSHA standard. So we're going to be looking at who is covered by the OSHA's bloodborne pathogen standard, what is the purpose of the OSHA's bloodborne pathogen standard, who must get trained under the OSHA's bloodborne pathogen standard, primary bloodborne pathogens, as well as case study to close up the chapter as well. Now, who is covered by the OSHA bloodborne pathogen standards? The standard applies to all employees. As long as you're an employee working under a condition that has a tendency of exposing you to blood or opium, you are covered by the OSHA standard. You understand? Then I say, what is the purpose of OSHA's bloodborne pathogen standard? So the purpose is to minimize or eliminate occupational exposure to disease-carrying microorganisms or pathogens that can be found in the human blood or body fluid. So that's just the aim of OSHA, to minimize and eliminate any of such risk. You understand? And say who must get trained under OSHA bloodborne pathogen standard. Now, as long as you are an employee, it is expected that your employers carry out this training for you to ensure that you are aware or you have the know-how or have the knowledge of these bloodborne pathogens that can be at risk to you. You understand? Then also OSHA has put in place exposure control strategies that can work for all bloodborne disease. So employers are expected to work with these strategies to also help to eliminate or minimize exposure to the bloodborne pathogens. So what are the primary bloodborne pathogens? You have the hepatitis B virus, as earlier said, hepatitis C virus, and also the human immunodeficiency virus, talking about the HIV. Now, these are the three most common bloodborne pathogens around. You understand? They are the most dangerous and the most common as well. Also, you have the West Nile virus, which is transmitted by the mosquito and causes the West Nile fever. You also have malaria and syphilis as examples of other recognized pathogens that can be transmitted through body fluids. So now this is a case study to close up this particular chapter. It says Stanley is an employee for a small manufacturing company. One of Stanley's job responsibility is to respond to emergencies that might happen in the warehouse. Stanley has worked for these employers for 5 years and has never had to respond to an emergency. The question here is does Stanley still need a bloodborne pathogen training, and why so? So these are some of the tasks we'll be discussing when we meet later in the week. So next is the specific bloodborne pathogens. So we're going to be discussing specifically on hepatitis B, the hepatitis B virus, the hepatitis C virus, as well as the HIV virus as well. So we'll begin with the hepatitis B virus. The hepatitis B virus is a primary cause of hepatitis, an infection which causes inflammation of the liver. So the hepatitis B is the primary cause of the hepatitis that we all hear of, understand. Now it can cause the various complications like cirrhosis, which is the scarring of the liver. Then also it can lead to liver cancer and liver failure. So it's a very, very dangerous illness that, if not well tackled, can lead to even death as a result of these complications that may arise, you understand. Okay, so we have types of hepatitis B. We have the acute and the chronic hepatitis B. The acute is basically a short-term infection or illness, rather, that occur within the first 6 months of being exposed to the hepatitis B virus. Usually, it does not lead to the chronic state and it can be taken care of, you understand? So if well taken care of or treated, it does not lead to the chronic infection. The chronic infection, which is a more dangerous infection, understand, that occurs after hepatitis B have stayed in the person's body for quite a while. And this chronic hepatitis can lead to long-term illness or health problem and even death, which can be resulted from the cancer we'll talk about and also the liver failure, you understand. So at the initial stage, which is the acute stage, it is manageable and treatable and no serious illness is occurred, you understand. But when it's not well managed and it gets to the chronic stage, it becomes more dangerous, become more long-term, and the tendency of death is even higher as well. So the symptoms of the HBV include, but not limited to, the following. So the HBV, we're talking about the hepatitis B virus. Now, some of the symptoms are that you will lose appetite, become fatigue, fever, nausea, vomiting, and abdominal pains, joint pains. Jaundice are seen in the eyes in more serious cases of hepatitis B infection. Now, this jaundice is one of the most known symptom of this hepatitis B virus, talking about the reddening of the eye. Now, some people that have this hepatitis B virus, usually their eyes becomes very red, you understand, have red eyes, and it's one of the symptoms that quickly point to hepatitis B patient, you understand. Most of these other symptoms, they are also related to other illnesses and sometimes can be confusing at the early stage. But this jaundice is the one that really shows that someone is suffering from this hepatitis B infection or virus. Then he said, note, hepatitis B can damage the liver, resulting in decreased liver function, as the ability for the liver to filter waste from the blood decrease, and the waste buildup in the blood increases. Only about 20 to 30% of persons with hepatitis B show symptoms. It is important to understand that even without symptoms, individuals with hepatitis B infection are still infectious to others. You understand? So basically, this hepatitis B is a major infection happens to the liver. Understand? So what it causes is that it damages the liver a lot, reduces the efficiency of the liver, and which causes further complication like the cancer and the liver failure that we said earlier. Now, one common thing to note about this hepatitis B is that most at times, it does not show symptoms. Very few percentage of persons exhibit symptoms, you understand? So it does not show symptoms, which makes it very dangerous. And the fact that it does not show symptoms does not mean that it cannot be transmitted from one person to another. You understand? Symptoms may not show, but yet it is still infectious and can be transmitted from one person to another. So it should not be taken for granted because it does not show symptoms. You understand? So the next is the exposure. So an exposure that may place a worker at risk of HBV, HCV, and HIV is defined as percutaneous injury, e.g. needle stick or cut with sharp object. That is to say, when you are being pierced, your skin is being pierced with any of these sharp objects like a needle stick or even a sharp bottle that is infected, a broken bottle or that is infected. If for any reason any of such object pierce your skin, understand, pierce your skin, it has a tendency of infecting you with any of all these bloodborne pathogens like the HBV, HCV, and HIV. Understand? So it's very important that you are careful with handling needle sticks or any form of sharp objects that may be contaminated with blood or body fluid that might be carrying this HBV or HCV or HIV virus. Understand? Then also contact with mucous membrane or non-intact skin, e.g. exposed skin that are sharp, abraded, or afflicted with dermatitis, with blood tissue or any other body fluid that are potentially infectious. This is basically talking about injuries. Now, when you have any injury, bruise to your skin, you understand, it exposes you. Now, if an exposed blood or opium come in contact with that open injury, is a very easy means for infection to occur via that opened injury. You understand? Once the blood come in contact with that mucus of your skin that is opened, the tendency for infection to occur is also very high as well. Now, every object that is contaminated is a risk. You understand? Once there is a blood on a particular object, it becomes a risk of carrying this hepatitis B. Understand? Because hepatitis B has a tendency of staying in an object for up to a week in form of a dried blood. So even an object that has a blood stain on it that is dried up, understand, also has the ability to infect someone with the hepatitis B virus. So it is very important that you take care and you always treat blood, whether wet or dry, as infectious. You understand? Then also vaccination. The good news about this hepatitis B is that there is a vaccine which helps you to fight against the infection. The vaccine can be taken in 3 shots, understand, given 1 month apart. You give the first one in a month, and then you give the first one at a particular date, then a month later you give the second one, then maybe 6 months later from the first one you can give the third dose, and with that you'll be immune to the hepatitis B virus. Now here is another case study. So Michelle is a custodian in a public elementary school. At the end of each school day, she's expected to clean and vacuum the building, including the school health room. While cleaning the health room, she noticed some dried blood on the floor. Now the question is, should Michelle be concerned about an exposure and why? So next we'll be talking about the hepatitis C virus. Understand? Now, hepatitis C is also a significant cause of liver damage and death. You understand? And this is the graph to show the amount of damages that it caused between the amount of infection that occurred between the year 2001 to 2016. So basically, just like the hepatitis B, the hepatitis C is also a very, very dangerous disease as well. Can also cause damage to the liver that can even lead to death in some cases as well. You said the hepatitis C virus. Say approximately 70 to 80% of people living with acute hepatitis C do not have any symptoms. Some people, however, can have mild to severe symptoms soon after being infected. So what they're basically saying is that people that are living with this acute hepatitis C, most of them do not show symptoms, understand? This makes it a very dangerous disease. A disease that do not show symptoms, understand? So you can actually have it and not know that you are having it. While in some cases, some persons they show mild symptoms, while some show severe symptoms as well. And just like the hepatitis B, we have the acute and the chronic hepatitis as well. Now, some of the symptoms that you may experience for someone that shows the symptoms of being infected by this hepatitis C virus is a fever. You have fever, you have the loss of appetite, you have vomiting, dark urine, or urine color changes and become darker. Then you have the joint pain, fatigue, and nausea. And so these are just some of them. Then also you have the abdominal pain. You start having pains in your abdomen. Then you also have the clade or colored bowel. This is a situation whereby you start noticing that your stool becomes brownish in color. Understand? Such a color of poo usually indicates infection by liver infection, which can be the hepatitis C virus as well. The yellowness of the eyes, which is the jaundice that we talked about. I said if symptoms do not occur, the average incubation period is 45 days after exposure, but this can range from 14 to 118 days. You understand? This basically saying that if an exposure if symptoms should occur, it means the hepatitis C virus have stayed in your body for at least a period of 45 days, which can also be in some cases between 14 to 180 days. You understand? Now, like I said earlier, like it was stated earlier, said many people infected with this virus do not develop symptoms. But the fact that they do not develop symptoms does not indicate that they are not infectious to others, which makes the disease also a very dangerous disease as well. Then he said treatment. He said according to the CDC, which is Central Disease Control, said 25% of people infected with acute hepatitis C will naturally be able to clear the infection from their body without treatment, which is a very good news. It means the immune system of some persons have the ability of fighting against this virus and conquering it even without any form of treatment being taken. You understand? Then also there are several medication available to treat chronic hepatitis C. Understand? Which means there are drugs actually that can be used to treat the chronic hepatitis C, which is equally a very good news. You understand? So it makes it, the fact that it's treatable makes it also a very good news. And he said, no, hepatitis B virus infected individuals are infectious to people, whether they show symptoms or not. Like I earlier said, that makes it a very dangerous disease. The fact that you can have it and not know. You understand? and you'll be living normally and doing other things, thereby exposing people to the infection without even knowing. You understand? Then another sad part is that there is no vaccine for this hepatitis C. So here is also another case scenario that we'll be discussing when we meet in our classes. We have here it said Manuel is a nurse working night in the local hospital. During a shift in the emergency department, he is stuck with a used needle that punctures his skin and draws blood. Question: is Emmanuel at risk of contracting hepatitis C? Why? What are your reasons for the answers that you give? You understand? We'll be discussing this when we meet in our classes as well. So next we'll be talking on the human immunodeficiency virus, which is a HIV. Now this is a very well-known virus and is one of the deadliest things, a virus on earth right now, one of the most dreaded disease. Why? Because it causes what they call the acquired immune deficiency syndrome, called the AIDS. Understand? It's a very dangerous disease and the most dreaded, one of the most dreaded diseases at the moment. You know, according to the statistics, it said at December 31st, 2013, 58 confirmed occupational transmission of HIV and 150 possible transmission has been recorded in the United States. You understand? As of 2016, there are about 36.7 million people, you can imagine, living with HIV around the world, with only 53% receiving treatment, which is very, very dangerous. This disease is a very dangerous disease that can lead to death in no time. You understand? And also another that makes it so dangerous is the fact that it has no cure. It has no cure, and there is no vaccine for it, just like the hepatitis C. There is no vaccine for it. Another funny thing about it is that it does not show symptoms until the very severe stage. You understand? Which means you can have it at the initial stage and not even know, and you'll be transmitting it without knowing. So that makes it a very dreaded disease as well. Now it says the mode of action. Now why this HIV virus is so dangerous is because of its mode of action. Now once this virus enters your body, the first thing it does is to suppress your immune system. It goes straight to your target, to target the cells in your body that are supposed to be fighting to defend your body against infections and pathogens. You understand? So it suppresses that immune system, finish it off, and expose your body to all kind of infections. You understand? Now, after having killed your defense system, having suppressed your immune system that's supposed to be fighting against infections, you become exposed. At that point, your body becomes viable for other kind of diseases and infection to come in. And it is usually these diseases and infections that come in as a result of this HIV suppressing the immune system that usually lead to death. Because with your defense system gone, your body is exposed to all kind of diseases. You can have liver problem, have cancer problem, whatever kind of problem can then come into your body. And usually these problems that comes into your body that end up killing the patient. Because at that point, when you start having big diseases like liver problem, cancer, kidney problem, death for you is inevitable, you understand? So this makes it a very, very dangerous disease, killing the immune system and exposing the body to all kind of infections and disease. Now, like I said earlier, one of the dangers of this disease is that it does not show symptoms. Especially at the very beginning, it does not show symptoms. Some persons may show symptoms of a flu-like symptoms like fever and all those little illnesses. You understand? But there is no real symptoms to point to that this thing that is happening to you or this thing that is happening to you because of you have HIV. Understand? It is only when it manifests to become AIDS, where you've acquired all the other kind of diseases, that now start showing more severe so that you will know that, okay, there is AIDS. So you can actually have this disease and stay several years without knowing, looking healthy and strong, whereas your body system, your immune system has been destroyed by the virus, and gradually sicknesses and all kind of other diseases are coming in. Understand? Until this disease becomes severe and you start falling weak and so many other things, and eventually you die. So this mode of action of it makes it a very, very dangerous disease. And like we said, it does not show symptoms until years after. You understand? And some of the symptoms that it shows include enlarged lymph node, fatigue, frequent fever, persistent or frequent yeast infection in the mouth or vagina. You start having yeast-like things in your mouth and the vagina. Then persistent or frequent skin rashes, short-term memory loss, weight loss, enlarged liver and spleen. All these are some of the symptoms that begin to show many years after the virus must have eaten deep into your body system. Like the hepatitis B and hepatitis C. It is important to understand that individuals with HIV are potentially infectious to others, even though they may have no observable symptoms. Understand? The fact that they do not have symptoms makes it very dangerous, because even without the symptoms, they can go around and spreading it without even knowing. So, which is the reason why it is very, very important to be careful with blood or other bodily fluid that can carry pathogens. You understand? Because a blood from someone who is healthy and strong, and you think the person is normal, that person may be carrying the HIV/AIDS without you knowing. Now, if you are ignorant of that and you carelessly handle the blood, you may find out that at the end of the day you become infected. So, as a safety-conscious person who is undergoing this training, it is paramount that you know that any blood, and like earlier stated with the hepatitis B, whether dried or wet, should be treated with caution, should be treated as though they are infectious, you understand? Because you never can tell. Now, presently, there is no known cure for HIV/AIDS, and the end result of HIV is death. There is no negotiation about that, unless you have some kind of divine healing or whatever. They said HIV cannot be transmitted outside the human body. It cannot be transmitted by air or water, insect including mosquitoes, saliva, tears or sweat, casual contacts like shaking of hands or sharing dishes, closed mouth or social kissing. Now, in as much as it is very dangerous, none of these listed methods can transmit the HIV/AIDS. Understand? It has not been recorded by scientists that air or water or mosquitoes even transmit HIV. So it is basically by contact with blood or through sexual intercourse, which is those bodily fluids apart from blood that was stated to be infectious, and can carry infection as well. So it has not been recorded that air or water, incense, saliva, tears or sweat, or shaking of hands, or closed mouth and social kissing all affects or all transmit HIV. They do not. So there is no point in discriminating, or there is no point in avoiding people with these diseases. That's if you find out that they have it. You understand? It's very important that you make them feel along. The important thing to do is avoid contact with their blood and avoid any form of sexual intercourse with them. You understand? Other than that, they are very okay to relate and live normally with. Now, here is a case study to end this particular chapter. Says Stacy is a police officer employed by the city of Denver, Colorado. She is often requested to respond to emergency medical situations, often arriving before the local ambulance company. As a result, Stacy is frequently exposed to human blood. Is Stacy likely to contract HIV from exposure to infected blood? Why? What are your reasons for your answer. So all these case studies we are going to be discussing when we meet on our platform later, you understand? So call it a day here. We'll be ending today's lecture here. Subsequently, we'll meet and we'll discuss on other aspect of the blood-borne pathogen training. So thank you very much for your time, and